And like that definitely hurt in here.
Got it. Yeah, but that Finkelstein's test is like, it's stenosis tendinosynovitis, called De-Quervain's syndrome.
Oh, yeah. Okay.
And that's usually the abductor pollicis and the extensor pollicis brevis that are going through this anatomical area, and it gets really irritated right through here. But doing stuff like this and this and this and this and this, not only is it a strength test that I did to you, but it also tests the tendons that are go up through the extensor region, up through here, as well as the flexor region through here, you know. And so we're testing this, and then I'm doing stuff like this and like this, and I'm really straining out the elbow. I could not get you to do that. Not to mention, your clinical history does not whatsoever speak of that. It's not like you're playing golf or tennis or backhanding things or forward-handing things. You're not doing a baseball. You're not doing a ton of pull-ups or push-ups right now that are leading me to believe in your case history or your personal activity at this point in time. That's telling me, yes, no, not to mention, forget case history. The symptoms are not the same either.
Okay.
I do think that it is very common to feel that numbness and tingling and think it might be tendonitis, but it's just not at all.
Like,
period. Like, hard no on that.
Yeah, you would know. I know. Here's the thing, is like, when I was, like, I'll still get these, like, especially this left pinky really can even hurt if I'm, like, pulling a blanket up. I know that sounds really stupid, but like this left pinky hurts sometimes. But like all the fingers.
Well, you do have nerves that go through all of them, and they are. I don't want to say this like as if it's like they're irritated, they're shot. I don't know what's going on with that, because like there's only one way to test that, and that's an NCV, EMG, nerve conduction velocity, electromyography kind of test where they test all the nerves. But they also have to test them at different locations and compare bilaterally to see what's going on side to side. I will say though, every single thing I did with your neck, whether it's flexion, extension, side bending, this bending, that bending, pissed off the nerves, irritated, on like flicking a light switch. So for me, like for every single test that I ever did for you for your neck, I did, and it created some level of irritation. The one cool thing is, like, I did test the numbness and the nerves that go out of the spine, and I pulled them down in this direction and this direction, and that didn't really cause a lot of pain. So what that tells me, there's not a lot of neural tension signs on the nerves themselves. Which leads me to believe, because what we're doing is trying to pull down the nerve from this direction that attaches to the neck, right? And when I left your head neutral in that position, but it pulled down the nerve, it didn't cause irritation. So usually in disc herniations and disc issues, we're thinking that can cause it. I mean, there's a potential, a possibility, in my opinion, just with how it is on both sides, how frequent it is on both sides, that there could be stenosing possibility. Let's talk about that. I said I was going to talk to you about that in a second. Stenosing, it really just means narrowing of the foraminal canal. I'm going to show you on this anatomy app. Or not app, this anatomy.
Like, is it normal to just go like this and I get a sharp pain here?
Not really. I mean, normal, no.
I know.
You know, most people can do this without having issues. But a foramen is Latin for window. And so there's a couple of types of foramens. One of the foramens can be the nerve foramen, where the nerves come out of the spine and then go down into the arms, right? I tested those. I told you those were negative. The other one could be the spinal cord itself and the little rounding of the ring right there, right? So imagine if we had I guess you could say a thickness of that hose, and it easily glides through here, but now we take it and we kind of wrap it a little tighter through that area, and it might be hitting both sides of the nerve of the cord, shooting pain out both sides and numbness into the tingling into the hands. I tested your strength. There is no loss of strength whatsoever. However, and I say this with like a little grain of salt, however, I tested both sides. I tested your numbness and tingling on both sides. However, it was done on both sides. You're having numbness and tingling on both sides. So for me to say that, like, because like usually, like, let's just say a disc herniation where it's pushing on one side of the nerve, it would cause one side of nerve irritation down the right side. This side would be normal.
Yeah.
We would have a good normal comparative
Okay.
and a not normal comparative. I would say that we were, according to the sensory test with the pinwheel, on all dermatomes, you were normal. On all strain testing, you were normal. But, and by the way, like, it's not like I haven't tested thousands of other people with strength. So even your testing, I don't know what you feel in terms of the sensory, but I in terms of the strength, you had the strength.
Yeah.
Even compared to another human being of your age and size, like, you have the strength.
Yeah.
You actually probably had better strength than some of the other people too. So I don't think you've lost strength, which is a big red flag for me.
It's a red flag.
It is a red flag when you've lost strength.
Oh, okay, yeah. So this is a good thing I'm not.
So when somebody goes to, like, and they're dropping their keys and they can't pick up a pocketbook and they're like, crap, my fingers don't work.
No.
That's a big red flag.
Right.
That's not a red flag for you, which is great.
Yeah.
What is a yellow flag is just having constant numbness and tingling on both sides that doesn't go away, and I can't help you find a position that makes it go away. There were a couple positions that did relieve it a little bit, but also I did it again and it kind of irritated it and then relieved it.
That's where I'm like.
So which was traction, which was me pulling up your head in this direction. When I went like this, you were like, that felt better. And then when I did stuff like other directions, you felt a little irritation. Like when I did the same thing while you were laying down, you felt a little worse, then it kind of felt a little better. But so I think like taking pressure off of the spine actually alleviated. Anytime I did flexion or extension, you didn't like. Any other movement you didn't like either. I don't like that you didn't find relief of positions. That's my big yellow flag there. That's my yellow flag or orange flag. The reason I say that is because how can I give you a proper exercise or what I call a first aid exercise? How can I give you something to do at home if I can't recreate that?
So I guess I need to focus more on that, maybe.
We do need to focus on that. I do think I can help you by treating the soft tissue around it. If you ask me personally as a chiropractor, I would not adjust your neck. I don't like to adjust on the first visit anyway, because I like to be able to prove that I can make changes. And I don't want to say prove, but I would like to be able to make changes with you and have you make changes at home for exercise-wise to see if we can help it. And if we can, then we know that the adjustment wasn't a piece of the pie and it eliminates a variable. That's just my thought on it and how I do it. And I also do think they should get you an MRI. I do think it. You have nothing to lose and everything to gain on that.
Yeah. Okay.
And you're smart enough and educated enough that you can make a good case for yourself.
Okay.
And if they don't listen to you,
I'll just go get one.
If they don't listen to you, just tell them that you want that documented.
Okay. Yeah. Thank you.
Say, I want that documented that you refused my MRI. Because if this is an issue that I need to know, then you know who denied you it.
So MRI on my neck.
I would definitely do.
What about, like, they isolate it so much, so just the neck?
They get all the areas.
Okay.
It goes from a lot of the areas. So you'll be able to get that, and I think that will help you. So I really want to work on.
Can you read those?
I can read them to some extent, you know. So I always claim that I'm not an expert. Like, I don't sit behind a black and white computer screen the way radiologists do. So if you want an expert to read it, have a radiologist read it. I will read the report, and I can definitely tell you about the report. I just don't want to pretend like I'm an expert in reading those every single day, because I'm not. But I do think that when we talk about your nerves and your neck, we're talking about potential for stenosis or irritation, or it may be what we call a central disc protrusion. That's what